right. Hello and good afternoon, Dr. Cristina. It is very nice meeting you, and thank you for interviewing with us today, 72 Dragons. My name is Rahul, and I'm the head of the writing department, and we are a production company based in Hong Kong. Today we have Dr. Pietro Aparicio, and he's the head of the health program for 72 Dragons. Dr. Pietro?
Great. Welcome. Just to give a small introduction, we have Dr. Cristina Rabadán-Diehl with us, who is an Associate Director for Clinical Trials and a multidisciplinary biomedical scientist. She's also a strong advocate in the field of substance use. Thank you for sharing your knowledge and expertise with our audience today. Our first question, Cristina, as part of your many responsibilities, you are an associate director for clinical trials and a biomedical scientist. Please share a bit about yourself and your journey in this field.
Yeah, sure. So first of all, thank you so much for the invitation and for having me in this program. So I currently live in the United States, in the Washington, D.C. area, but actually I grew up in Spain, in Madrid, where I got my degree in pharmacy. I came to the United States in 1987, and there's where I started really my professional trajectory. I completed my education with a PhD in molecular biology and biochemistry, and then a master's in public health. I was in the Miami area for about 6 years until 1993, where I moved to the DC area and I started working for the National Institutes of Health. That, as you probably all know, it really is the biomedical arm for research in the United States of America. Over there, I was a bench scientist and also a program administrator for over 20 years. And at that time, I actually started also working globally in many disciplines. In 2018, after 25 years of service, I actually left the federal government to join Westat, which is a research supporting organization where, as you said, I am an associate director for clinical trials. But really, because of my expertise, I serve as a subject matter expert across the entire health sector, which also extends beyond clinical trials, which is also public health and epidemiology and behavioral health.
Wow, very impressive background and very great and significant work you're doing. Thank you for sharing.
But besides working nationally and internationally in various public health programs, you are also actively involved in substance use initiatives. And I understand that you and your family were directly affected by this terrible problem. Could you speak about the magnitude of the current situation of substance use, particularly in the US?
Yes, absolutely. As you said, I am now very involved in substance use disorders and addiction. During my professional career, particularly during my time at the department, I was touching those things, those topic areas as conversations at very high level, as well as from the biomedical discovery. But as you also said, unfortunately, I have been impacted by the current opioid epidemic in the United States. My oldest son, Jonathan, was 28 when he lost his life in 2019 due to an accidental opioid overdose. And that perhaps was the reason that has prompted me to really be out there, to engage in multilateral and multisectorial collaborations in this topic area, because I not only bring really the scientific understanding of this disease, but also the personal experience. The United States is currently under a public health emergency status on our opioid epidemic. Every day, approximately 300 people die of an overdose in this country, and approximately almost 190 are due to opioids. The trajectory of this epidemic in the last 20 years has changed, but it has clearly dramatically changed since the appearance of illegal fentanyl. Fentanyl is a very potent opioid. Other opioids like illegal heroin, but also you can see traces of fentanyl in marijuana, in some pills, in basically everywhere. This is not only in the United States, but it is all across the world, but specifically is impacting our country because it is starting to happen at all ages. And unfortunately, we are even having a huge increase in adolescent death.
That's terrible, what's going on. And we hear a lot about the opioid epidemic, and the statistics, as you mentioned, they're alarming. What actions are the current government and health authorities implementing to address this epidemic? Could you mention a couple on how effective they have been?
Yes, I think that, as I mentioned, this epidemic started really at the end of the 1990s, approximately 1999, and we started seeing an increase in deaths. It was really during the appearance of fentanyl around 2013 when we started really seeing a major impact in death due to this substances. So the federal government, one of the things actually that the federal government did is to declare a public health emergency. And that was big because until now, particularly the use of illegal substances and continues being obviously penalized by law. And it has really been mostly the domain of the judiciary system and not so much recognized as a public health problem. So the fact that the United States declared, and currently President Biden has ratified that declaration as a public health emergency, it really had elevated this problem under the umbrella of a disease. And I think that is something that is very important. So the United States has taken many actions at the government level, and particularly interactions with non-government organizations. One of them has really focusing on harm reduction. And particularly there's a substance called naloxone that but for people who are experiencing an opioid overdose, if administered correctly, could prevent deaths until first responders come in. So there's been a tremendous push as far as educating the population, as far as training with naloxone, making naloxone available. That has been actually very effective. I think another example is to regulate not only the prescriptions of opioids in a better way, a more effective way, but also looking at options for medication-assisted treatment for individuals who already have developed an addiction to opioids. This has already been recognized through research that this is an illness, that the people that are suffering from this disease are sick and should be treated with the same compassion and support as anyone else who may suffer from other diseases like cancer, diabetes, or heart disease.
Yeah, it's interesting that you mentioned this move from being a judiciary or legal issue to a health issue, to a public health issue, and how that really has changed the scope of how this issue is being addressed.
Yes, and my next question is actually kind of related to the things that you've mentioned right now. Certainly, yes, the government of the United States is working on this, but what do you think is the role of the civil society, the community, the families and friends who are experiencing the consequences of substance use in their homes? So how can they contribute to the battle against substance use?
I personally think that families, loved ones, and civil society play a huge role because they are bringing the human face of this disease. It is proven that in many other diseases, civil society and patient-based organizations have really influenced in a very positive way the advancement to treatments and prevention of many diseases. And this disease should not be any different. In my opinion, civil society has a very important role, particularly for breaking that stigma that still is around substance use disorders. One of the biggest problems that we have is that many family members and individuals hide the fact that they do have a member with a substance use disorder, to a certain extent stigmatizing and contributing to that stigma even more so. especially when an individual dies, like in the case of my son, people try to hide the cause of the disease. As a matter of fact, until very recently, the death certificates did not actually indicate that those that had died due to substances, that was actually the cause. Normally it was either unknown cause or heart attack. So it's important that we, the families and the members, start speaking about that as any other disease. But I also think it is important that we are active. Very often family members, either because of fear, because of lack of knowledge, or because of pain, we don't want to be part of this movement. On the other hand, I do think that the more people like me and others speak up, the more we will be able to bring that lens of effectiveness of any program that is going to be created and implemented. Very often, public health professionals and non-government organizations sit around tables trying to address these kind of issues without really having the perspective of the individuals that have been affected. Very often we include people with lived experiences or people in recovery, but there are not that many out there. But the perspective of the families and the friends is invaluable, because this is a disease that, even though it may affect only one individual, it's a family disease.
And you are working with underserved populations in the United States, with the other programs that you work in low, middle income countries. So the issue of substance use, as you mentioned, is a global problem. As a public health expert, what's your advice to the public health workers in the U.S. and internationally who are struggling, even how to start addressing this complex challenge?
I think that the first thing that we need to recognize worldwide is that this is not a new problem. This is a problem that we've had for decades, and that it has been recognized by international organizations like the WHO and others. However, I think that the impact of now overdose deaths due to these synthetic opioids, it has made this a much top priority problem. And like other substance uses, like alcohol or tobacco, we have guidance, we have international community, we have a lot of non-government and government organizations and civil society that are involved in that space. So I think that my recommendation, particularly for public health professionals, is to start that movement, that there is a need to create that community, multi-sectorial community, around illicit drugs. As you said, this is an international problem. As a matter of fact, it is expected by the year 2030, there will be an increase of substance use around the world, with approximately 30% occurring in sub-Saharan Africa. In the meanwhile, while we are hoping that community mobilizes, I would like to encourage, particularly those that are working on the ground. The community health worker is an individual that it is part of the community, but at the same time, it has a role as a intersection perhaps between the formal health sector and the community. Those are individuals that have been used very effectively for other diseases like maternal child health, diabetes, nutrition. And we should really focus in and rely on community health workers as well as nurses and other health educators. I think that the most important thing that we can do as public health professionals is talking about this as a disease.
I would like to thank you again to do this interview with us and bringing this subject into light. And Dr. Pietro, would you like to add something here?
Sure. Cristina, thank you so much. It's been an honor and privilege talking to you about your incredible journey and the incredible work that you are doing in the battle against substance use.
Well, thank you very much. As I said, I think that we can tackle all of this together.
Thank you. Thank you, Cristina. Thank you very much.